The Canadian Medical Association is calling on provinces and territories to rebuild the healthcare system amid overflowing emergency rooms across the country and a surge in respiratory illnesses. Let's go live to CTV's Kamal Karamali. Joins us live with more on this. Thanks for joining us. Canada is facing an unprecedented health crisis right now with respiratory viruses, also the flu causing severe overcrowding in hospitals.
Absolutely.
What have we been hearing from the front line on this pressing issue?
Well, doctors, nurses, physicians, and their medical associations, Jamie, are once again sounding the alarm because the problem doesn't seem to be going away. You know, we've been reporting on this since November, into December, as cases of COVID-19, influenza, and RSV just continue to surge. And now the numbers are getting to a level where doctors say, hospitals really cannot handle it anymore. We're seeing wait times go into the double digits, in some cases more than 20 hours, where patients are pouring into hallways, pouring into waiting rooms. In Kingston, a hospital is operating at 120% capacity consistently, for example, and in BC out west, a record for its inpatient hospital population with more than 10,000 patients. That's the inpatient hospital population in one given day. Now, the Canadian Medical Association wants provinces and territories to rebuild the healthcare system, calling for a complete revamp of the primary care system. And they're calling, Jamie, for a more streamlined process. What they're saying, not to get too much into the weeds, but that really right now, a lot of these documents and information and where to send patients is very piecemeal. There's no coordination. And so they're saying, let's start back from the ground up. There needs to be a streamlined process, more consistency across these different medical branches so they know where to send patients, and more communication between them. And once again, health officials saying, please don't go into the ERs if you feel like you can avoid it, because that just adds to the problem. But, tough to tell them what to do when we've heard time and time again that 1 in 5 Canadians don't have a family physician. So that's why many of them are heading to the hospitals.
I'm sure you and probably a lot of people watching this program right now know someone that has been hit hard by the flu this year. I got hit earlier, and I know a lot of people are really sick right now. What's the latest data suggesting on how bad the flu season is so far this year?
Well, I'll do you one better. Our colleague Scott Hurst, who also shares this desk with me, just had to go home just an hour ago because he wasn't feeling well. And so good thing he did. That's obviously the right move to do. And but we all know somebody who's been hit and continues to get hit. Our newsroom was decimated in December, and now we're seeing more colleagues get hit. So everybody knows somebody who's getting hit with the flu. But Public Health Agency of Canada just released the data for the last week of December. Once again, it takes a couple of weeks to wrangle this data together. So we're just recently receiving these numbers, and about 7,500 positive tests of influenza specifically in the laboratories coming in. That's a positivity rate of 19% of all cases that are being swabbed and taken to labs. So influenza really taking a surge here, and you can see the incremental, well, not so incremental, incline on a week-to-week basis. So it looks like it's still on the rise, Jamie. You can see by that bar graph there. The slight good news, you can see those numbers, only 179 hospitalized, 22 in ICU. So it looks like, people are getting checked out and then heading back home, not having to stay in hospital, but still rising numbers for sure.
CTV's Kamal Karamali, we appreciate the update as always. Thank you.
You're welcome.